here at TDS. Thanks, Lou. We are so pleased you could join us today and help spread the word about the important new 3-digit dialing 988, the National Suicide Prevention Lifeline. I want to thank the speakers who are with us today and behind me, U.S. Senator Tammy Baldwin, Wisconsin Secretary Designee Karen Timberlake of the Wisconsin Department of Health Services, Wisconsin Secretary Mary Kolar of the Wisconsin Department of Veterans Affairs, and then joining me from TDS are Shane West, our Senior Vice President of Network Operations, and TDS's 988 Project Lead, Paul Najedlow. In addition, we invited a representative of the Wisconsin Medical Society, Dr. Jerry Halverson, a psychiatrist and chief medical officer at Rogers Behavioral Health, who unfortunately could not attend today. Beginning tomorrow, people needing mental health assistance can call the new 988 mental health hotline. The number has been in the works for years and involved congressional action, Federal Communications Commission approval, and infrastructure improvements by phone providers like TDS to ensure these important calls get through. TDS cares deeply about the mental health of not only our associates, our customers, family, friends, and neighbors. We provide phone, TV, and internet services in 32 states. Too many Americans are suffering from a mental health crisis without the support they need. At TDS, we feel strongly that 988 will save lives and provide access to critical mental health services. U.S. Senator Tammy Baldwin co-sponsored the National Suicide Hotline Designation Act, and we thank her for helping to make 988 a reality. Senator Baldwin.
Thank you so much, Kathy, and good afternoon. I'd like to start by thanking TDS Communications for hosting us here today. Getting 988 up and running has taken significant effort from so many partners, including our telecommunications industry. I'm also pleased to be joined by Secretaries Timberlake and Kolar, whose state agencies have been key partners in ensuring that 988 callers are directed to and receive the care that they need. And to our healthcare professionals who have been some of the most vocal advocates for patients facing mental health challenges, thank you for your hard work also. Our country is facing a mental health crisis, and death by suicide is an urgent public health problem. This was true before the pandemic, and it is true today. This is a reality in our veterans community. It's an issue in the LGBTQ community. And suicide is the second leading cause of death for young people between the age of 10 and 24. Right now, when people are experiencing a mental health crisis and want or need help, many have to rely on existing 10-digit numbers that they certainly don't have memorized. Or they will reach out to the only number that they may remember during a crisis, 911. However, sending our police to a mental health crisis can be a misdirected use of our law enforcement and first responder resources and may not give those in crisis the direct connection to compassionate, accessible care and support that they need. We need to help those in mental health crisis. We need to prevent death by suicide by breaking down barriers and improving resources and services that are available and making them very easily accessible. That's why in 2019, I was proud to introduce and pass bipartisan legislation to make 988 the new National Suicide and Crisis Lifeline. Tomorrow, this legislation becomes a reality when the easy-to-remember 988 goes live. The Lifeline provides 24/7 services. It's free and confidential to provide support for people in distress. It provides prevention and crisis resources for you or your loved ones, and best practices for professionals in the United States. Most importantly, 988 is going to help us save lives. I am so excited to join the partners gathered here today who have helped bring 988 to life. Tomorrow marks a major step forward in addressing the mental health crisis in America and providing people hope for healing. I am proud to have done my job as your senator by delivering support for Wisconsinites in crisis. So thank you.
Thank you, Senator Baldwin. Next, join me in welcoming Wisconsin Secretary Designee Karen Timberlake of the Department of Health Services.
Thank you so much, Kathy, and good afternoon, everyone. We are very pleased to be here today to celebrate the launch of this important new resource for our state. And while the 988 Suicide and Crisis Lifeline is new, the number is new, that functionality is not. As Senator Baldwin noted, 988 replaces a National Suicide Prevention Lifeline number that has existed for some time and that certainly people across Wisconsin and across the nation have relied upon. So we are very pleased, first of all, to thank Senator Tammy Baldwin for her leadership in sponsoring the legislation that both made the 988 number a reality and is providing critical funding to states, including Wisconsin, to make sure that we can offer this essential service to everyone who might need it. I also want to offer our thanks to Family Services of Northeast Wisconsin, who has years of experience operating the Wisconsin Lifeline and is the state's primary vendor for the 988 Suicide and Crisis Lifeline. This means that in Wisconsin, Wisconsinites who call 988 are getting their calls answered by people right here in Wisconsin who are familiar with local resources. I would also add my thanks to the team at TDS, both for welcoming us here today and for lifting up the really critically important role that our telecommunications companies have played. None of this is possible, none of this becomes a reality without the hard work that telecommunications companies like TDS did to make the original 10-digit consistent number a reality and now also to make 988 feasible. Perhaps what's most important for people to know from the Department of Health Services perspective is that Wisconsin is ready to implement this 988 number. We have been planning for this for more than 2 years, working with partners who include behavioral health services providers, consumers, people with lived experience, our telecommunications companies, county human services, and many more, all of whom have helped us shape the service that is now the 988 resource. Senator Baldwin noted the critical need for this service. We know that calls to the suicide crisis line and now the 988 Suicide and Crisis Lifeline have been on the rise in Wisconsin, as they have been around the country. We know that suicide rates among Wisconsin residents have themselves increased over the last decade. So it's really critically important that people understand that 988 is a resource that is there to help them in a confidential 24/7 way. What happens when you call? Wisconsinites who call 988 will be connected, as I noted, to in-state counselors who will have a great understanding of local resources and local opportunities for help. Most of the time, people are offered that kind of immediate counseling and de-escalation support and service. Sometimes they're offered a follow-up call. Sometimes in a more acute emergency, there may be a need to reach out to other kinds of resources. But the bottom line is the first step is to make that call. And that is what 988 really will offer to people. So let me conclude by again just thanking our behavioral health providers, Wisconsin Family Services, all the crisis counselors who are going to be taking these calls, our county human service partners, our law enforcement partners, the 211 system and the 911 system, which are sort of the bookends that surround 988 now, people with lived experience who have helped us make sure that this truly is a compassionate and responsive service. Certainly our policymakers and our telecommunications companies, all of whom have been essential partners with us at the Department of Health Services and with Governor Tony Evers and my colleagues in the Evers administration in making this a reality. And now I'll turn things back over to Kathy.
All right, thank you, Secretary Designee Karen Timberlake. According to the Center for Disease Control and Prevention, the suicide rate has been rising in the general population and especially among veterans. Here to talk more about the crisis is Secretary Mary Kolar of the Wisconsin Department of Veteran Affairs.
Thank you. Good afternoon. As Secretary of the Wisconsin Department of Veterans Affairs, I advocate on behalf of over 340,000 veterans who call our state home, as well as their families and their survivors. I am a veteran myself, having served 28 years on active duty in the Navy and retired as a captain. From veterans across the state, from different backgrounds and generations, I hear a similar sentiment shared again and again. To quote, "Of the men and women who served with me, I've lost more to suicide than to combat." This is deeply personal to me and to the many who have lost friends and loved ones, the ones who are no longer with us. As a population, veterans are particularly vulnerable to mental health crisis. They are more likely to experience post-traumatic stress disorder, depression, isolation, and combat-related guilt in their transition to civilian life. However, no suicide is inevitable. Every death by suicide is preventable with access to the right resources. This is why accessibility is so crucial. The reason we are all here today, making this hotline number easier to remember and call, a hotline that is proven to be an effective tool in a crisis, will save lives. To all veterans who are struggling, please know, no matter how big or small of a crisis you are facing, you are not alone. Help is available for you, and it's here for you right now. In fact, the National Suicide Hotline has a feature specifically to the unique needs of veterans. Any veteran in crisis can now call 988, press the number 1, and be connected with the Veteran Crisis Line. You will be connected with a real person qualified to support veterans. You do not have to be enrolled in VA benefits or VA health care to make the call. None of this would be possible without the support and partnership of so many across our nation, our state, including our regional and local veteran support groups. My sincere appreciation also goes to Wisconsin Senator Tammy Baldwin for her advocacy and the legislation that made today a reality. I am grateful for her unceasing support for our veteran community and for being a strong voice in Washington, D.C. for those who served. Thank you, Secretary Designee Timberlake and the team at the Department of Health Services for your implementation efforts and for all your work to keep Wisconsinites safe and healthy. My thanks also to TDS for your leadership and commitment to mental health and being our gracious host today. Accessibility to mental health resources is vital for all underserved and vulnerable populations. WDVA is proud to stand with all of you to prevent suicide and get life-saving mental health support for those in crisis. Thank you again, sincerely, for being here today.
Thank you, Secretary Kolar. Joining us next is my TDS colleague, Shane West. Shane is the Senior Vice President of Network Operations and has worked for TDS for more than 25 years. He came to TDS Telecom from our sister company, US Cellular, and will talk briefly about the process of implementing 988. Shane.
Thanks, Kathy. Along with telecommunication providers and interconnected VoIP providers in every state, TDS was required to build out infrastructure for 10-digit dialing and implement 988 in all of our networks. To move to 988, it was more than a flip of the switch, though. Our TDS team spent the last 2 years working to meet this deadline in 19 states and 28 area codes where TDS currently provides telephone service. Last month, we accomplished this goal, completing the work ahead of the July 16th, 2022 deadline. TDS's number management team was responsible for the organization and coordination of this massive job. Our network translations team spent more than 500 hours working to enable 10-digit dialing in all of the markets we operate in. At TDS, we are pleased to be part of this process. We care about the mental health of our customers, our 3,200 associates nationwide, and everyone in the country. I want to acknowledge and thank Paul Najadlo, who is the Senior Administrator of our Number Management Program, on a job well done. Paul also serves as a member of the Federal Communications North American Numbering Council, and I'd like to bring him here to speak.
Thank you, Shane. Thank you. For the past couple of years, I've been attending monthly industry calls held by NAMPA, the North American Numbering Plan Administrator. The process involved a lot of moving parts. However, I am so pleased that we were able to complete the project ahead of schedule. Our next step is to make sure our customers are informed about 988 through a robust communications process. This is a very important step to help reduce the stigma of mental health and will hopefully mean more people will reach out when needed. Thank you.
So again, I want to thank our speakers today for joining us to spread the great word of our new mental health crisis hotline, 988. I would encourage everyone here to talk about this number with your coworkers, family, and friends. Thank you. And if there are any specific questions from the press regarding 988, we'd be happy to take those.
Is there a time that it launches?
Is there a time?
Tomorrow.
It's actually already live.
Already?
The official launch is tomorrow, but we've had a little bit of a soft launch just to make sure we were ready. So it is already live.
Thank you.
Maybe a question for the senator. I think I read this interesting stat from the FCC, the Communications Commission. They said that they gave a specific number for suicide deaths in 2021, and with the launch of 988, they expect that within the next full year, they expect that number to at least double. Can you kind of point to that statistic just a little bit about 988? What does that show? Yeah.
Yeah, so I think what they expected at least double is the number of calls to the number. And I think part of the reason for that volume increase is just that this is, first of all, going to be publicized at events like this. So people will have more knowledge that these resources are available. Secondly, as I was mentioning before, the 10-digit numbers, I remember there being a suicide hotline that served this community back when we used to have phone books and you could look something like that up. We don't anymore. It's harder to figure out how to access the service. And certainly with numbers already saved on our smartphones these days, we don't even remember, some of us don't even remember our own 10-digit numbers. Okay, that's a little too far, but you know what I mean. The point being that people don't remember this. And so now with the publicity, with professionals being able to provide this as resources, as family members of people in mental health crisis or a family member or loved one contemplating death by suicide, we can also be the bearers of that information. So those are, I think, the major reasons why we expect to see a considerable increase in use. And certainly we all hope and pray and expect that it is going to save lives.
Tell me a little about the legislative sort of process that changed the percentage.
Yeah, so I worked across the party aisle with my colleague, former colleague, Cory Gardner from Colorado. And we teamed up on this legislation, in part knowing at that time, and this was pre-pandemic, that we were seeing increases in the numbers of death by suicide, and we were seeing it disproportionately impacting certain populations that we, that we both were advocates for. So whether that be veterans of our armed services, or here in Wisconsin, and I think he was also observing in Colorado, increased rate of rural resident suicide for agricultural workers and farmers because of the major financial stress that people were going through, and a real increase among LGBTQ youth in particular. And we knew that the existing resources were not as accessible as we would like them to be. So Cory and I worked together. It was very bipartisan legislation, and it went through, I wouldn't say without any hiccups, but it went through with a lot of support behind it. But as you heard today, it wasn't just passing a bill and having it signed into law. There's a lot of technical work that goes into making this work on the part of our telecommunications partners. And we need to make sure that when somebody calls, there's going to be somebody who answers the calls promptly. So there's our call centers with people with training, and then the resources to refer people to, because it's not just the call, but you want to be able to make sure that you're following on. And so there has been, in the bill itself, we charged the Department of Health and Human Services, and particularly SAMHSA, which focuses on mental health, to provide resources to the states to staff up. We also provided some authorization to states to raise additional dollars through fees on cell phones, and it's voluntary per state. Wisconsin has not yet selected to do that.
All right, thank you, everyone.
Great, thank you.
Breaking news, traffic, and weather alerts as it happens.
The Channel 3000 app. Get it now.
Powered by News 3 Now.
News